Okay, I've just turned on the record button for this presentation since we've gone through a lot of unnecessary things. Is there any other questions from the people who are online?
I don't have a question, but I have a little help with
Michael,
the.
I see you got your computer up and running.
Yeah, with the when I first turned it on, the voice was not up high enough. So I went into the little arrow beside mute down on the left side of the computer, and I went to audio settings, and that'll bring up a screen where you can turn your audio up.
Oh, okay, good.
Okay.
See, those are helpful hints that basically we'll be able to pass on to the people because, like I said, we just signed up with the new company. It's called Zoom. It seems to be a lot easier, and at least from the standpoint is that Michael and I can both attest, is that the other company that we had prior to this, we couldn't even contact or we couldn't get hold of a real person if we had to.
Wow.
And we've been able to get technical support, when we needed it within 5 minutes. So from that standpoint, they've been they seem to be very good, and it seems to be one that we might be recommending for other chapters that have given us a call. So.
I called in late, so I missed when you were saying how many people were on the line.
No, I didn't. I didn't go through that. Like I said, the participants today. Matter of fact, the number one participant we're missing is the doctor today. So, and I apologize for that. I don't know if you caught that to everyone. I called the office. He had called me from his office, and I tried to return the call. And I also just sent him an email asking him to join the presentation. And I'm hoping that there's no emergency that he's addressing. So. But we all know that people at times have busy schedules and do forget. So I'm not making excuses, but at times it's reality. Yeah, just make sure I'll send it again. So it'll be a little bit of a pest.
I know if you have scleroderma, it's hard. It's really hard to do 2 or 3 jobs in one day.
Yeah, and like I said, the doctor has been very kind. So you know what? With all due respect, and I respect everyone who called in. So let's do it this way. Let me step through the presentation, and if the doctor does call in, we'll allow him to do his best for that. But this was a presentation that he put together and he just sent to me this past Monday. So from that standpoint, we'll talk about the role of pulmonologists in scleroderma. Dr. Regis is a medical, as you can see here, director of pulmonary hypertension, very much involved with the professor of medicine at the Michigan State University and part of the Spectrum Health Clinic. All righty. Let me just ask, I have everyone unmuted now, so from that standpoint, since we're without the doctor, I'm going to make this a little bit more of a different but an open discussion. So basically, if people want to chime in off of it, can everyone see the screen, or some of the people just calling in? I'll read the slides to you. Symptoms of lung problem: shortness of breath, cough with or without sputum, chest pains or pressure, wheezing, fatigue, leg and abdomen swelling, heart palpitation, lightheadedness, and fainting. So I guess the real thing is that these are all symptoms that basically patients should be aware of, should be monitoring, and basically should be really concerned, especially. This is very helpful for what I would say is that patients who've had scleroderma for many years, they're probably looking at this and says, yeah, I know all this. But really what you have to think about is that the people who are just been recently diagnosed and don't understand some of the signs and some of the things that can, be linked to lung problems. And they sort of brush it off as being something else, as being maybe I worked too hard, maybe I'm getting a bit of a flu. Heart palpitations, I've had those in the past. Lightheadedness and fading, I haven't eaten much or sleeping well. These are all symptoms that basically we have to be cognizant of and make sure that we are doing the things necessary to understand what is going on with our body. The lungs, and we can see is that this is a simple diagram of exactly how the lungs work. It's an exchange of the oxygen, of the carbon dioxide, and the oxygen into our blood cells, and basically just to inhale and exhale, and through the walls of our lungs. And as we all know, is even though our lungs look thick, the lung is a very thick, thin tissue.
The doctor didn't even.
I'm going to mute everybody now.
Some guy from wherever. Fill in.
Sorry, but I'm trying my best. I'd like to make sure that we all have the presentation, and it's one of those things that I apologize to everyone calling in, but I want to share the slides that the doctor did share with me. All right, next we talk about the pulmonary arteries and how basically we look at it, how the oxygen is exchanged within our bodies, through the various as being the oxygen is exchanged in the as you can see the blood cells through the pulmonary arteries, and the aorta is exchanged through the heart, and then basically pumped through, and then we exchange the good gases from out of our body with the new gases. As you can see, the oxygen poor, CO2 rich blood, and oxygen rich is red for here. So this is one of the things that, I am not a doctor. It's hard for me to explain this, but from that standpoint, it gives you an idea of why the body is working and the way that we're exchanging the oxygen to our body. Branch of the pulmonary artery, explaining a little bit more about the way that the lung works here with our heart and through the sacs of the bronchial sacs, and how that is done for us. Now, I'm sure the doctor would talk to us a little bit more about the impact of scleroderma on with the pulmonary system. And as you can think about it, the membrane here is a very thin membrane. And as with scleroderma, what occurs with that is that it becomes harder. And then that's something that basically, as it hardens, it becomes harder to breathe and to do that oxygen exchange. And if you think about it, that's where we're back in the original discussion where the wheezing, the coughing, the fatigue, you're not getting the oxygen into your bloodstream enough to allow you to exchange that, to get the oxygen in and the carbon dioxide out of your system, to allow your body to continue to work on its own. The main things of lung involvement: pulmonary fibrosis that is affected, and hypertension. The interstellar lung disease, ILD, interstellar pulmonologist, involves airspace and alveolar and interstitial space in between. Now, Michael, you might know, and I'm sure you know a lot about this than I do. And so from that standpoint, if there's anything that you would like to talk about or chime in about some of the experiences that you have, I greatly appreciate it. Let's see. Okay. Mike, do you want to talk again? You're muted on your end. So from that standpoint. There you go. I heard you click in. Pulmonary hypertension, high blood pressure in the lung circulation, thickening and narrowing of the small blood vessels. So as I was mentioning earlier, the thing is that where scleroderma affects the lungs and with is pulmonary hypertension and the fibrosis. And I keep scanning as I'm talking and walking through these slides to see if the doctor does call in. I'm just going to mute because a few phone numbers have come up. Has the doctor called in yet? Okay. And like he says, I apologize again to everybody. Unmute. And Michael. All right, Mike, you're back unmuted. As we were just talking about, pulmonary fibrosis leads to a stiff lung and to decrease the lung volume and capacity to hold the air. Symptoms, shortness of breath. Prevalence, very common, but severity variable. 10% have severe disease. More common are the severe and diffuse skin disease, offset typically early within the first 5 years of the disease of scleroderma diagnosis. So it's important when the doctor says he hears that crackling, he hears that in your lungs. One of the things that is important, if you can, is to make sure you're exercising your lungs, is that if you have the ability to exercise, is to do exercise, because it's important that, and I'm speaking it from a caregiver. My wife, matter of fact, today is 2 years to the date that she passed. She had scleroderma for 19 years. And one of the things that she really was very focused on, it was very important, and it helped her out very, very much, was her focus on exercising and trying to make sure to maintain what she had, and we all know that you're not going to improve, you're not going to get better, but basically is to maintain where you are and to establish that good baseline. As you can see here, the doctor is showing us what I call the normal lungs and lungs with the fibrosis. And as you can see the differences between these two. And the tiny airways, you can see the pulmonary, the networks, and you see the differences is where you see the fibrosis here in the buildup versus you have the additional area that allows the lung to exchange the oxygen for that. As I mentioned earlier, and like I said, I haven't read this beforehand, so from that standpoint, physical exam, you hear the crackles, as I mentioned earlier, is that you try to maintain that. When you have your chest x-ray, you'll see the mililinear shadows. And you have the high resolution thin cuts computed of the chest. So you'll have the different ways so that the doctors will do the assessment. And it's important that, and I understand that insurance is a dictating factor on many of this, is that how you can go about for treatment. But it's important that you get the exam and the assessment and you stay on top of it. And so the idea is that many people only deal with a neurologist, but it's very important that as part of your team of doctors, as you work towards maintaining your health, is that you have your team of doctors, and one of those on the team has to be a pulmonologist, has to be a cardiologist, has to be a neurologist. Wrong way. Yep. All right. Now we have the typical. We show the normal scan on the left, and we shall show the differences. So you can see the differences on your own. And I wish I had the technical background to give you the clinical definition of this, but I think it's rather obvious is that of your good lung and your bad lung is you can see the different fibrosis, you see the different dark spots versus on the left, we'll see more of the white. And so from that standpoint, you don't have the fibrosis within the lungs. Just here is the two different ways that that you'll do the testing. Some of the ways that you'll see the different tests will be done at the clinical. And I'm just going to open this up before I go too far so I don't lose it because I have everyone on mute.
Do you have me on mute?
No, I had you off mute for Mike. For some reason you weren't that. So let me just ask, has the doctor joined? Okay, I'm going to put everyone else on mute. And I apologize for this. I'm not trying to play doctor, but I just want to make sure I share the things that we have, with you. So it's basically where we're able to do it.
If you can hear me, John, I can tell people that probably have had this test before. What's going on?
Why don't you explain, Mike?
Well, considering I just had this done yesterday, the pulmonary function tests are very critical in the assessment and the maintenance of people with interstitial lung disease. How my interstitial lung disease manifested was shortness of breath. My pulse ox was low. It was also winter, breathing cold air, and found out that you gasp for breath. That started my journey with interstitial lung disease. So they did the various tests, the scans, and all the specialized x-rays as you showed, which determined the fibrosis of my lungs. I was a former smoker, and damage to your lungs from smoking is different than the fibrosis of this lung disease called by the interstitial lung disease. And my biggest problem for my breathing is not only do you have reduced lung capacity, but then when, like me, you have your tightening of your skin. And my skin was so tight that I compared it to I was wearing a wetsuit, like a diver's wetsuit that was 2 sizes too small. And I was getting a constant bear hug. So when you try to breathe to expand your lungs, which are incapacitated anyway with interstitial lung disease and the fibrosis, then you can't expand. Your body goes into survival mode, which mine did. I was panting all the time. I wasn't breathing. But the pulmonary function test will gauge you on the amount of air that your lung capacity is a test. And then also the absorption. That's why they have the gases, various gases like the tanks there, because they can judge how much oxygen your body is absorbing. I do believe that the CellCept mycophenolate that I'm on has helped. It has put me, I am stable as far as the lung involvement. It has not gotten any worse. And of course, it won't get any better, but that's the good thing. So I periodically have these pulmonary function tests, which are great. They're well worth it. So I'll turn it back over to you. And John, too, I want to say, too, is you're apologizing. And I just want to say, I'm going to tell you to calm down like you told me to calm down earlier, because this is out of our control. I've got a fellow Scleroderma warrior that messaged me through Facebook from the West Coast that's on board. And she said, this presentation is just like Scleroderma. It takes us sideways. We always have the unplanned in life. So this is exactly welcome to the scleroderma world, John. Here we are, and you know it all too well, and but here we go. But you're doing a great job. We'll muddle through, and if the doctor doesn't make it, we're just hoping that it was not an emergency. I also did contact Laura. I know she was in with a conference call to see if she could contact him directly, too. Back to you, John.
Well, as you can see here, this chart is a little bit, when you're first looking at it, it's a little bit confusing, but it's really, I think you have to read this more from right to left. And when I say that is that as you look on the right-hand side, it shows your total lung capacity. But then as you move from off to the left, it basically says, okay, what is the vital capacity? What is critical? And then when you move all the way to the left-hand side, that vital capacity really breaks it down into three separate areas. As being your reserve, your tidal volume, and your exploratory reserve volume. And how that all works, or how it all interdependency, Mike, I don't know if you know that, but you have the residual volume. In other words, is that there's always some air that I can probably easily say is that you don't expel. So when you take a deep breath, you don't breathe 100% in and 100% out. It just doesn't happen.
Correct.
You're always exchanging a certain percentage, and that's what this is showing here. So as you can see here is that what the intake here is being you inhale, and then basically exploratory is when you're exhaling. And then when you get your tidal volume is about basically, I will have to assume that is basically is your normal or baseline there. So, okay. All right, this talks about the effects of it, forces your vital capacity that we looked earlier on the chart. Below 70% of the predicted base for your gender and height. Your total volume of your capacity is reduced. So if you think about it, if you were a normal male, and let's say 45, or normal female 45, is that basically with and without scleroderma, and the percentages that it's affecting you. And can't speak to that, but it's one of those things that says it's forcing you to only 70% of your breathing capacity. Decreased diffusing capacity reflects the ability of the lung to take up CO2 as a surrogate for oxygen. So, due to the thickening, as we talked about earlier in the fibrosis, is that you're not getting the oxygen and the exchange of oxygen and CO2 that is necessary for your bloodstream. So as we all know, is if you get you always heard the term, I'm not getting enough red oxygen blood cells. And that's exactly what this is that because of the fibrosis here, the pulmonary function of ILD is that your bloodstream is not getting that blood exchange necessary for you to stay healthy. Treatment of
you're going to the next slide, John, is the reason I had my pulmonary function test yesterday. It was a repeat. I had one done the end of October, and I explained to the technician, it was a scheduled one, that I had a upper respiratory infection. That should have been the sign right there to stop. It should not have progressed, and my rheumatologist conferred that decision because that it gave us false readings. And so when they compare your pulmonary function test to previous ones, that's their gauge to see if you've stabilized, you're getting worse or whatever. But you throw in a factor of an upper respiratory infection, and it's also already compromising your lungs on top of your interstitial lung disease. They should have never pressured me for that. If any of these, and I'm sure everybody that's on listening to this has had the pulmonary function test. They're a pain. I mean, they're hard to do, but if you're compromised with a cold, so it threw the charts off the charts. My rheumatologist said they should have never done it. He was mad at the pulmonologist for doing it because it showed that I had gone off the charts. So I had to repeat this. So I'm just telling people, if you don't feel comfortable doing any tests like that, tell them, So
make sure it's a great point, Mike, and to everybody, as you know as well as anybody, is that you got to be honest with your doctors. If they tell you, if they say, "Aren't you feeling well?" Or "Are you feeling okay? You have a cold?" Be honest. Tell them, because like Mike had just testified, is that these are things that basically will affect your results. So, treatment for ILD. I am not going to even talk about this, and the reason being because I am not qualified. But what I would like to say is that, as you can see here, there are therapies, there are beneficial things. As Mike said, he's using CellCep. Other people are using the other two drugs, and it is something that can help you. So from the standpoint, if you have ILD, it is not basically there's nothing. It's not to say that it's not curable. It's treatable, and so from that standpoint, there are therapies and there are benefits. Studies, basically the effects of with and without various drugs. As you can see, there's different types of treatments that have been going on in studies has been, for that. So the best way to think about it is that there is research that is going on. There are testing of the drugs that are there, and so and what effects they have on scleroderma. So I think it's important to understand that even though we can't look at it, you can see that at times different things will give you different results, and you will see different results over the periods of time using different, more of an immediate versus a long-term result. Oh, wrong way, sorry about that. Side effects of the one drug is increased risk of infection, low blood count, gastro side effects, increase malignancy, long-term use not established. So I mean,
I'll be the judge of that because, sorry, John, I'll go back to this personal experience. I was diagnosed in the fall of 2013. Goodness gracious, a long time ago already. But anyway, I had the choice of going direct to chemotherapy. I chose to do the mycophenolate. It's a roll of the dice. We get all the pros and the cons, but that's the choice, the path that I choose, which I'm happy to do. I was told at the time I would be on it for 5 years at the max. That's like the round they do, or they found that the mycophenolate will work. I'm on 2,000 grains a day. I already had the gastro side effects. The white blood cell, I do not have that. Increased infections, yes, because your immune system is down. You just stay away from sick people, wash your hands, the lifestyle that everybody should do anyway. The increase of malignancy, we just found out last year that the leading cause of death in scleroderma patients used to be organ failure. It has been surpassed now by cancers. Generally, not any specific cancers, but mostly melanomas and some, but it's because of our immune system and the drugs we're taking it. Now, they say the long-term use not established. Well, like I said, I'm going to be probably... Well,
Mike, let's just stop right there. Let's not get into it. Let's not...
No, I just want to say this one thing, John. No, I'm not a doctor, but I'm just saying is when I was going on this for 5 years, I was told to be 5 years. Has been informed now I'll be on it the rest of my life. For the fact is, the mycophenolate has changed my life. Seriously, it's turned my scleroderma around to I'm stabilized. So they have found when they remove you from mycophenolate after you have responded so greatly that if they take you off it permanently and then you try to go back on it, or what happens is the scleroderma comes back with a vengeance and then the mycophenolate is not effective. That's the point I wanted to get in there.
Right, and so like anything is that, as Mike and I talk about any of these drugs, is that your doctors and the long, as I said, long-term effects use not established. It is still, I don't want to say a trial, but it's still where people are learning more, because as many of you know who've had the scleroderma for maybe 10 or 15 years, the progress is tremendous over that time. So.
Right.
So let's continue the stem cell transplantation. I'm going to just read this to you, and I'm not going to interject because I don't have any any knowledge to add to it. So 2 randomized studies have been shown benefits in patients with rapidly progressive skin disease and internal organ involvement, including ILD. Lung function stabilized or improved. High risk or early complications require specialized center. So with that, is that stem cells that they're saying is that we do have treatments. There are 2 studies that are going on, and right now is that very early in the stages. Hypertension, pulmonary hypertension, meaning pulmonary arteries pressure is greater than 25 and normal is 20. Thickening of the walls of the small pulmonary arteries resulting in narrowing and increasing resistance to blood flow. Right side of the right ventricle compensates with increased muscle that can dilute and ultimately fail. So what it's saying is that pulmonary hypertension will affect the heart, and that's one of the things that you have to be very careful of with your lung disease. And people always question, well, wait a minute. If I have scleroderma, what does that have to do with the lungs, and how does that affect my heart? As you can see how these all 3 sort of intertwine between one another, and how scleroderma will play havoc on the body, not just on the what you would think is your outer skin, but your internal organs as well. I'm not even going to go into it, but basically this is vascular remodeling and myocardial remodeling. And I don't know what the doctor was trying to discuss or show during this part of the presentation. So I'm going to skip to the next slide. Let's see, the pulmonary hypertension is in scleroderma patient occurs 10 to 15%. More common in limited variety. It's basically part of the anti-serotonin. Boy, I can't explain. Centromero antibody, typically after a long duration of the disease, can occur in isolation with ILD, shortness of breath, fatigue, fainting, and leg swelling. Other causes of pulmonary hypertension need to be considered. Left side of the heart problem, blood clots. So one of the things is that you always have to be concerned, and if you think about blood clots, what the other items that you have to be concerned with blood clots is strokes. So it's just something that it's something that a lot of times isn't talked about, but it's something that is prevalent within scleroderma patients. Testing in pH, echocardiogram, images of your heart, estimates pulmonary pressure. Right here you have HRCT to assess the ILD. Now what heart CAT scan to assess the, your ILD. Scan of the blood cells, normal blood workup, reduction of your DLCO, sleep study, and your six-minute walk test. I think most patients who've participated with their cardiologist have done a 6-minute walk test. I know my late wife, we used to go to the University of Michigan, and that was our once a year, that would be her 6-minute test with her cardiologist. It's very important, and that's where, as I mentioned earlier, exercise of being able to do what you can do, and to be able to push yourself to the standpoint of that you want to be your own advocate moving forward. In other words, the best you can do is to be able to stay steady and constant, but you have to work at it just like anybody else. This talks about shows the differences of the lung, and I'm not going to explain it. I should say of the heart, and this is something the doctor wanted to talk about. Another picture of the heart muscle, Doppler effect. So these were all things that I'm sure the doctor would have been able to add a lot of value to. Cardiac catheterization. I'm sure many of us have gone through a catheterization. and to take a look at your heart and to measure the pressure in the hearts and lungs if they need to be. It's I don't want to say it's a simple process. Anytime they inject or put anything into your body, it is not normal, and any type of a procedure has to be taken seriously. So from that standpoint, you can see there is value in it. Just like anything else, you have to be your own advocate with your doctor. You have to understand what the doctor is trying to accomplish and why. So anytime that the doctor is asking you to do a procedure like this, it's not to say that it's not the right thing to do, but just make sure you understand what's the value and also what are the risks when it's being done. Treatment of PAH, general measures, as you can see, diuretics, for fluid retention, oxygen if needed. For women, avoidance of pregnancy, avoid drugs that impact heart functions, and targeted therapies roll and combine with ILD. ILD and pH has not been established as of yet. Approved drugs. These are just the approved drugs for PAH. I'm not going to talk to them. I think they're very, how can I say it? They are what they are. And what it does show is that there are a lot more advances that there were than 10 years ago. There are a lot more drug manufacturers that are coming into the marketplace to provide solutions to help. And when I say solutions, as being ways to maintain your presence, your present being with your lungs. But it's just like anything else. Drug companies are involved because basically they have a solution, and let's be honest, they also can make money. And that's why many of these are there. But it is significant that you do see that more and more drug companies are becoming involved in issues that are addressing scleroderma. Upfront therapy talks about the combined therapy and the efficiency if nothing is done versus what is done. And you can see that over the number of weeks, things don't improve, but things are better than if you did nothing. So the question is that what do you do? How do you do it? And that's something depending upon your condition and your work with your doctor.
We got another participant just logged in. Is it by chance the doctor? I see another one up.
Hello, I'm going to unmute all and just to see if he's there. Hi, is the doctor on?
Nope, darn.
That's okay. Okay, I'm going to mute everybody back again just because.
I was hoping.
Yeah. So let's just do this. Because last time I tried to do a group mute, I muted you out, Michael.
Oh, that's okay. Sorry.
Okay. All right. Well, we only got a few more slides left. So with that, and like I said, I'm not taking any questions. So side effects of the drugs, as you can see, the different drugs do have side effects, and you do see some things as being fluid retention on one. You have headaches and GI upset, GI upset on two of the other drugs. So just like anything else, even though they address things, and we all seen the commercials on TV, and it seems like they advertise the drug for 25 seconds, and the other 35 seconds of the commercial are side effects. So you have to be aware of it. It's very important that you understand that, because one of the things that various patients will react differently, and I'll just speak from as a caregiver. My wife did have side effects from some of the drugs that she was taking, and it's just important that you understand it and then basically address them as immediately as possible. Okay, Mike, so this talks about here basically some of the things as being with catheter infections and system problems, headache, flushing, GI upset of being taking some other drugs. So one of the things you got to be careful of is anytime you do any take a drugs, you have side effects. And I did not understand this. I guess what is it? This is a drug being a delivery system that is through the catheter site pain and headache, flushing, GI upset. So I guess there are some drugs here that basically I did not know about. Mm-hmm. And I will say I will unmute all and ask anybody is that once I thank you for your patience. And I also want to say is that I'm going to thank you for participating. What occurred tonight is I'm not going to make any excuses. I'm sure the doctor had an emergency came up and was not being able to attend. He was gracious enough to give us his presentation. And so from that standpoint, I tried my best to walk through it with you all. Hopefully you were able to ascertain some value from it.
Look how red that area where the catheter is.
Yeah,
Ugh.
that's a blowout.
Well, what that is I've had something like, I've never had that there, but I've had to run, wear monitors with those sticky patches for a long time. And those sticky patches will react to the skin. It's almost like a latex allergy, but it's not latex. So that is, it's a dermatitis issue with the patch, not an infection of that. So I can throw that in there. So, well, good point though.
Well, at least I realized that we do have the crew. We're paying attention and didn't fall asleep and drop.
There we go. Yep.
So
I would like to ask a question.
Sure, go ahead.
My name is Mary Logan. I'm from Atlanta, Georgia.
Hi, Mary.
I've had scleroderma for about 3.5 years. So I'm a youngster at it. And I haven't had any pulmonary problems yet. But I was wondering about the drug linabulin that is rolling down the tube toward us about the beginning of next year, 2020. We have they're doing a clinical study right now on linabulin. And I wanted to see if anyone in this group had heard of it or tried to get into the clinical study.
I, for one, have heard of them. I am not a candidate for trial runs because I've stabilized so much that I'm not as critical as I used to be. So my rheumatologist doesn't want me to participate in clinical trials, but I have heard of them. Okay. I have not, and they're, you don't hear anything until they're done, obviously, but I know there is a government site on clinical trials. I don't have that right now in front of me, but you can go online and search these out and they'll tell the progress of them and a lot of information. I wish I had that information, but I know it's.
Yeah, I have already signed up for.
Okay, cool.
Yeah, I've signed up for the one at Cleveland Clinic. And they're offering me to come, but I wanted to know a little bit more about the contents of the medicine, because they said, and they make it very clear to you, that the CBD medicine in it is CB, I think it's CB, is it CBD for the cannabis?
From like hemp? Yep.
Yeah, from the, it's made from a cannabis product, but it's not natural. It's a
synthetic.
Yeah.
Okay, I guess what is it? Unless we have a doctor on here, I would like for us not to speculate, but Mary, I would think your best thing would be to talk to a rheumatologist or to give a call to the Cleveland Clinic and ask to talk with one of the doctors or their associates where they can give you more information on that.
Okay. Yeah.
I'll be honest, and the reason being is that the last thing we want to do here is to give information that basically could be speculative or could be used basically
right.
correctly. You know, from that standpoint. And like
I was just fishing to see if.
No, that's quite all right. But that's great news to hear that you're going to be that they want you part of the trial. So
I was just wondering, I'm trying to just find out from anybody else. Now the hospital, the doctor, a couple of doctors have already said that it's safe, that the linabosum pill is going to be safe once they get it out on the market. But I just don't know. I like trusting people that's already been through it, you know.
Well, I don't think because of it, just so you understand how drug trials do go, is that they do have multiple rounds of them. And so what they do is that there is times where they will make a little change or improvements to the drugs from trial 1 to trial 2 to trial 3.
Right.
So like I said, it's important that you talk with the Cleveland Clinic, and if maybe that they can help you a little bit more to maybe address some of your concerns.
Okay. All right. Thank you so much.
No problem, Mary.
Hi, this is Dee, and I'm from Idaho, and I just wanted to add a little bit from the previous discussion to answer about Corbus. It's through Corbus Pharmaceuticals, and my understanding is it is in phase 3, and they also are treating it for dermatomyositis. So I just wanted to add that little tidbit in there for anybody who's interested.
Hi, Dee. Thank you.
Sure.
Okay. With that, I'm going to say, look, I'm going to wrap this up for the evening. I'm going to say thank you very much to everyone who came and participated and listened to me rambling through a set of slides. So from that standpoint, I want to thank
one more. I got a closing remark. Okay, John, can I do that?
Michael.
All right. Well, we muddled through. We made it, and I think I sweated out about 5 pounds, but I'll get over it. But anyway, the next webinar will be March 14th, and it will be hosted by Dr. Richard Martin, the founder of the West Michigan Rheumatology and Research for Scleroderma Patients. The presentation and topic will be Innovative Therapies for Scleroderma Patients. Once again, that is for March 14th, and we will be sending out the promotional
check our website within the next week or two, and basically we'll have the link where you'll be able to sign up. I'll be setting up and scheduling the meeting for that March 14th.
Then the correct link, right?
That is correct. So.
All right.
Hold on a second. I see Bruce is raising his hand. Bruce, you have a question?
Yes. Can you hear me?
Yes, I can.
My name is Bruce Cowan, and I'm from the metropolitan New York area, and I'm involved in the Tri-State chapter. And Mike and John, I just have a comment. You've done a wonderful job.
Thank you.
I know about pulmonary hypertension. My wife was a patient in the 90s. And one of the most important things that you both said is there's a lot more treatments around today than it was, 15, 20 years ago. So
it's changing.
Together, we'll help each other. You guys did a great job. Thank you.
Thank you, Bruce. We appreciate that. I do. Yes.
Thank you, Bruce. And to everyone, like I said, hopefully everyone had a good new year. And I say thank you again. And we'll look forward to talking to you in the March timeframe.
Okay. Thank you, Michael and John.
Thank you.
Mary, and everybody that called and participated, thank you, and appreciate it, and stay healthy and happy.
All righty.
Thank you.
Bye-bye.
All right. Thank you, guys.
I say.